Gagru.net. This is Gagru live on Facebook with amazing guy. I met them 3 years ago when Armenia was the happy, exciting place. And this gentleman is Professor Chaltikyan. He's professor, he's a doctor, he's an expert in the digital health and physician and surgeon. And I'm sure there are more things he could introduce. And Mr. Chaltikyan, welcome.
Well, thank you very much. Thank you very much for having me. It's a pleasure being here today. And first of all, I would like to wish everybody a Happy New Year and a Merry Christmas.
Okay.
Surgeonnt, to our Armenian audience. Yeah, my name is Georgi Chaltikyan. Indeed, like you said, I am a physician by training, and I have worked for about 20 years as a general surgeon, as a doctor. And in the past 12, 13 years, I've been working in this domain of digital health. And I'm currently a professor for digital health at a University of Applied Sciences named Deggendorf Institute of Technology, that you can see on my background picture, and heading a master's program in digital health.
Let me run this video to bring some memory back, the good old day Armenia.
Yes, actually, I just wanted to also reiterate or stress again how important, how critical is data privacy and security issues, specifically in healthcare. And it is probably enough to mention that in the past decade or so, while we were following digital health news.
Okay, so that was you talking about the security stuff. So anyway,
there's nothing I can do about it. Yeah.
Welcome back. So you saw that the beautiful things, how excited was the Republic Square. People were packed in that auditorium that we were there doing the conference. It was packed with people. It was an amazing day. It was. But today is totally different. We're all depressed. So tell me about these digital things. Latest one, what is happening, what is going on?
Yeah, that's right. Back then in 2019, we had this amazing event taking place in Armenia, the World Congress on Information Technology. That was a great success. And it was, before the pandemic, before that catastrophic year of 2020, with all the resultant turmoil. However, we have to be looking into the future. So we've continued working on this initiative, on Armenian Digital Health Initiative with our colleagues. And we have also Currently, we also have other colleagues from both Armenia and diaspora who have joined us and who also feel the importance of digital health as a domain for for further development of Armenia and for prosperity. And it is very critical to well, first of all, maybe a quick reminder what the talk is about and what is the wider domain of digital health, as we call it. Is basically the use of various digital technologies, as the name suggests, right? It could be defined as simple as that: the use of different digital technologies in healthcare, for health, for wellness, and in medicine. And those technologies are quite a few of them. There are various subdomains in digital health. One such technology is the so-called electronic health records, right? Where the healthcare providers are able to record patients' data in digital format, in digital health records. And then it is also important that all that data is stored securely and can be also exchanged from one doctor to another doctor. So doctors can make more informed decisions. So the digital health records and the health information systems, this is just one subdomain or one type of digital health technology. Then we are talking about telehealth or telemedicine, or the so-called virtual visits, ability of patients to see their doctors over a video conferencing link or over a video conferencing app, right from the comfort of their home or office. And now this technology has also been around for quite some time. And then, of course, talking about digital health, it's multiple other technologies such as robotics, such as augmented reality or virtual reality technology, such as digital imaging. But perhaps the biggest, the greatest advantage or the greatest prospect of digital health lies in the ability of doctors and other health workers to continuously measure and record various digital data on patients, on consumers, and that data can be collected through a number of devices, such as nowadays, for example, there is already a range of consumer devices, such as Apple Watch, or other sensor devices that a person can be essentially wearing continuously. And those sensors, they can record various data, both in health and in disease. And what does that give? That gives an opportunity to collect a very significant amount of important data on how our body works. Now, with the ability of process that data, analyze that data, and also integrate that data with some genetic information, such as, for example, coming from genomics studies, that is going to bring about really revolutionary opportunities in identifying the trends, predicting the illness, and also being able to manage everybody's condition, everybody's illness on an individual basis, because this is going to be quite a revolutionary change. We are essentially now witnessing a new upcoming, completely new era, a paradigm shift from medicine that has been more or less standardized for some conditions, for cases, but not so much tailored to an individual patient, to an individual person. And now we're moving away from that paradigm, which was absolutely critical and necessary at the time, because without that standardization, without evidence-based medicine, as we call it, the developments in medicine and healthcare in the past, 5 or more decades would have not been possible. But now we are moving towards a little bit away from those more standardized approach. Still, of course, everything based on sound research, based on evidence, but moving towards more individualized approach when every person with their data, with all their uniqueness, be it genetic uniqueness, be it biological uniqueness, and all the way to even social uniqueness. Now, all that data are going to be input into algorithms, and we're going to have more algorithms that are capable of analyzing this huge amount of data and coming up with individualized prediction, individualized prevention approaches, and individualized treatment approaches for every single person. And that is the era that we call precision medicine, or individualized, personalized medicine. Now, that is perhaps the biggest potential of digital health technologies. And in the next decades, there is no doubt that we're going to see quite revolutionary changes in that direction.
So this data, like for example, I don't know how it's in Germany, but in the United States you have those group insurance group, medical health groups. So your data would be just within that group. So if you go out of there, they have no access to your data. How this gonna be centralized?
Absolutely. This is an absolutely critical and important question. It's a question which deals with one of the major challenges in the domain of digital health and health information systems, and that is the challenge of interoperability. In the former times, and also currently, like you mentioned, in many areas, even in the most developed, health systems, such as here in Western Europe or in North America, data, a lot of patients' data and a lot of consumer data remains in what we call silos. Individual fragmented systems that do not necessarily talk to each other. So the major challenge is to not only store data, to not only collect the data, but also to make that data available when necessary. And of course, here, once again, as I mentioned in a previous interview with you, and we're going to talk about that also today, I guess this morning, we will be speaking about the strictest requirements for privacy and data security. Of course, the data belongs and must belong to the person, to the individual, to the consumer, to the patient. So the patient, and we always stress that, the patient will always be in the center of that process. However, it is absolutely critical that data on the single patient, on a single individual, which is stored with various healthcare providers, that data can be shared among healthcare providers for the benefits of the patient. Now, there is a lot of progress that has been achieved in that direction. For example, now there is a host of different data standards. And data standards have been developing in the past decades, and there has been a very significant effort towards the standardization of data coding technologies, so as computer system of provider A use the same data standards as the computer system of provider B, so whenever necessary, they can easily talk to each other and exchange data when necessary in order to support care of the patient. Furthermore, there is a trend currently establishing something like common data space. For example, here in Europe, there is a very significant initiative titled European Health Data Space. Now, what's that about? It's exactly about what you just mentioned, that we have individual health systems, fragmented systems. You can compare it to the US situation where you guys have individual health systems structured around several providers or health insurance plans, right? Which do not always, each of them, sort of storing their data. Now, compare it to the situation here in the European Union, where there are, let's say, 27 member states, and even if you happen to have unified system, health system within a particular nation, which is already the case in a few countries in Europe, most notably, let's say, the Nordic countries, Scandinavian countries, or Denmark. They have an integrated health system, which is essentially, collects and stores health data on basically almost every citizen of that nation. There is the same situation is in Israel, for example. Israel is one of the greatest examples of that. Finland, Estonia are other great examples. But now imagine, in order to advance further health research, it might not be enough even having a few million patients or few million citizens data in the same system. So what this initiative is about, this European health data space, is about the ability to bring that data in the, again, I have to stress here, in the most secure way. And we call this anonymized data, which means the data that has been stripped of any personally identifying information, right? Nonetheless, this health data can be clustered together, analyzed together, and once we have that data available on millions of users, not just tens or hundreds of thousands, but millions of users, let's say in the entire European Union area, that will bring about unprecedented opportunities for health research. Because in health research, everything is about data, and there must be a significant amount of data in order for the most advanced techniques of analyzing that data, and we call it big data analysis, right? And health data analytics. And a lot in that is based on the approaches which are commonly grouped under the name artificial intelligence. So how does that work? The researchers develop algorithms that are capable of predicting and defining what should be the prevention and treatment based on a significant number of parameters. Now, all of that had practically been impossible before development of these artificial intelligence techniques, but it is possible now. However, in order to build very reliable and very accurate algorithms, it is necessary to have a significant amount of data. And that is what all health systems are currently moving towards. So that is absolutely important. To summarize all that I've just said, it is critical that data which is stored in individual health systems can be exchanged in a meaningful way. And there it is important to have technology interoperability, which is about technology standards, as well as it is critical to have organizational interoperability, right? It's important to have the legal and regulatory and organizational framework that allows health systems to exchange data, that allows health systems to use that data for research, that is going to bring new advances in medicine and healthcare. But of course, first and foremost, a framework must be in place that protects data on an individual patient or individual consumer, and that allows every person to benefit the most from the data that is being collected and that can be used for treating that person, or even for preventing a healthy person from ever developing health problems.
In every show, we try to run about 30-second remembering our soldiers. So if you don't mind them. Okay, so this is, I just made a habit remembering those guys.
Thank you for that. Thank you for that. Yeah. Absolutely.
So, you know, like I have this watch. I don't know if you see it. I use it for walking steps, how many miles you walk, stuff. But the rest of stuff I don't understand it. It's a medical stuff. Two, I don't know how accurate it is. So what can you say about this kind of watches?
Well, absolutely. Again, you're mentioning very important aspects. Absolutely important and critical aspects that are also the challenges that, you know, the digital health community, the experts and researchers are working actually on, or have been working on since the most recent development in the field, and will be working to solve those issues in the near future. That is absolutely correct. In order for us to tap the potential, the true potential of digital health, like we said earlier, those devices, and what you've shown is just an example of, well, you can call it a wellness wearable or fitness wearable, right? It's in essence all these, you know, smart watches nowadays, or these fitness wearables such as, you know, Fitbit products that recently the company, as you know, probably many of your listeners know, has been acquired by Google. And by the way, that is, I'll quickly mention it in a while, a little bit later, you know, how big companies, tech giants, are now so much into digital health. I'll come to that in a few minutes. But you're absolutely right. It is, first of all, it is absolutely critical that these devices, the sensor technology, is continuously improving. We are every year and every month we are getting, you know, better sensors, newer devices, the sensors that are smaller. This miniaturization trend and the trend in the engineering domain, in sensorics, that is something that it's essentially also work in progress. Second, what is important, it's always important to conduct excellent research on all those devices, all those technologies, right? By comparing them and to, for example, conventional medical devices. Like imagine that there is, let's say, a wristband or a watch which is measuring your blood pressure, 724 continuously. Now, if and when it is proved, and we already do have such devices, when you're able to demonstrate that this, you know, small appliance that you are able to wear essentially 724 almost continuously, except for example when showering or something like that. Imagine that if you show that this device gives you reading, blood pressure reading, as accurate as the conventional device, which is quite inconvenient. It's quite inconvenient for a person who has elevated blood pressure, you know, to put on that cuff several times a day, you know, to turn it on or to see it and so on and so forth. Now, once you have these readings, and once you have proven that these readings are accurate, and no less important, we need to also come up with a with the new system of interpretation of that data. Again, as an example, let's say you measure your blood pressure using a conventional blood pressure cuff device a few times a day. For that, doctors ask you to sit for a few minutes, right, to relax, to kind of to restore to your natural state. And if you had been, for example, exercising or even moving around your flat before putting on cuff and measuring, so the reading will be somewhat different, right? So you need to. What am I implying here is that the doctors used to have a system of recording and interpretation of data, which might not necessarily be exactly the same system as we are going to have with these continuous devices. So we would need to come up with a novel approaches to interpreting the data and to making perfect sense out of that data. Now, that is very much a work in progress, and that is, of course, the vast area of current research in digital health. However, there is no doubt that there will be more and more such sensor devices that will be recording the data, and we will be having more opportunities to interpret and to analyze the data, also using those artificial intelligence algorithms that I just mentioned a few minutes earlier.
So let's talk about this. It seems to me most of those devices has to do with your heart. So far.
Not necessarily. Not
Well,
necessarily.
we'll get into it. So basically this heart monitoring, when you go in hospital, they plug you with cables and they give you this wireless device you put in your pocket. But that one, there are people, for example, nurses monitoring maybe 5, 10 people. But nowadays, those things they put you on your heart, like some monitoring device, and then they give you a cell phone. And so the cell phone will supposedly send that data 24-hour to this, not the hospital, not your doctor, to this remote corporation,
Center.
someplace in the world. Say in case United States, could be I could be in California, that device could be in Minnesota. Now, how could those companies monitor thousands of people day by day, 7-day, 24-hour? I'm a little bit have some question about that, like how accurate that, or how could they afford to monitor thousands of people? You explain that.
Oh yeah, absolutely. Very, very interesting, very important questions you raised. Yeah, indeed. I mean, imagine that there is, let's say, company. Let me bring here the example of Apple. Apple is the largest and the biggest tech giant, and recently, just a couple of years ago, the CEO of Apple, Mr. Tim Cook, he gave an interview. That interview can be accessed and can be viewed and watched. And in that interview, you know what he said? He said that if we look into the future, and let's say a few decades from now, people ask, what has been the greatest contribution of Apple to mankind? He said it would be health, which is just one example of how seriously people who are also in charge of big technology companies, how serious are they about digital health, right? Now back to your question, and we'll come to that also. I will also be glad to give you some examples of how national governments are taking digital health seriously, understanding that it is the future, and the future not just the future of healthcare, and not even just the future of health of the citizens of those nations, right? Many national governments understand that digital health is poised to be economic booster.
Yeah, big one.
And an area that will allow nations to essentially to prosper, and that is the basis for our initiative and our work to make or to establish an ecosystem of digital health also in Armenia, because our colleagues, we also think that digital health might be such a game changer for Armenia and Armenians as well. And that is the essence of our digital health initiative. I will talk about that probably in a few minutes. Coming back to your question, remember I told you that we have nowadays, and the researchers all over the world are working on algorithms of artificial intelligence. Now, these are the technologies that will permit automated or semi-automated analysis of huge amounts of data. So imagine if you have a company, or you are, for example, a provider of such service to a health system or to a hospital, to a healthcare provider. Exactly what you've mentioned is, by the way, already also has in some areas and in some for some conditions, actually what the case that you've just described has already become nearly routine, nearly mainstream. You're absolutely right. A patient with a heart problem, and not only heart problem, by the way, there's also lung problems, such as the chronic lung conditions. It can be for diabetes, it can be for mental health problems, and for a number of other problems. They can be a device that a patient is taking home, basically, right? And like you said, the device is connected to the smartphone, and the smartphone is collecting data and either collecting on its in its memory, but most of the time just streaming data real time. And the modern technologies, such as cloud computing, the so-called Internet of Things, the upcoming upgrades to mobile broadband, such as we have 5G now. There is already a lot of work going on the next generation of mobile internet, on 6G, right? And what is that about? It's about the possibility to stream huge amount of data at the same time. And what cloud computing is about, it is basically, it means that all that data is being continuously streamed onto the servers of that service provider, right? It is going to the servers, and the servers nowadays are capable of storing and analyzing, data on millions of people.
Right.
Think Google, think Apple, think
Amazon,
Facebook, or any other, Amazon, of course. That's all. It is absolutely technically possible. However, the questions there are still quite serious, of course. And you've mentioned some of those issues. For example, if my data is being streamed and stored on the server of Apple, then who is going to be essentially how do I make sure the ownership of data, right? Who owns that data? Then how is my doctor given access to that data? Now, all these issues, obviously, they are a very significant part of developments in the digital health domain. Good news here is that apparently everything can be handled safely. Of course, there are challenges, but those challenges simply need to be addressed in the best possible way, as they say, one problem at a time. Yeah, and with regard to, if I may now get back to this initiative that we are developing and that we want to establish essentially in Armenia. What's the rationale there is that we think that Armenians, both in Armenia proper and in the diaspora, do have quite significant capacity in healthcare, in medicine. There are many doctors all over the world of Armenian origin, and there are many healthcare professionals also in Armenia proper, who are absolutely, to the highest international standards, right? And we also have quite developed technology sector. There's a lot of engineers, a lot of IT people. So bringing these two together, and also with the opportunity of global development and global influence of Armenians as a networked nation, as a distributed nation.
I was going to come to that Armenian stuff later, but sorry for that. Well, let's talk. Let's mix a little bit politics and healthcare. Armenia have lost, I was told, about almost close to 10,000 people with this coronavirus. Now, I don't know how accurate is that. And Armenia is the fourth place, the most per capita lost to the coronavirus death. And so where is this problem? Is an incompetent government? Is backward society? Or a healthcare not prepared?
No, there is a combination of factors. And unfortunately, there are very few national governments, if any, that can be said to have addressed, to have met this coronavirus pandemic challenge, and to have done everything in the best possible way. If you could mention such a nation or such a government that have done everything, or have avoided any problems with this pandemic, frankly speaking, I could not. Look at situations in countries with significantly more developed health systems than Armenia. Look at the situation in the United States, right? Look at how challenging it has been in Britain, in France, in Italy, Spain, Russia, and elsewhere.
And we're talking per capita. Per capita date, Armenia is the fourth place in the world. So that's
Armenia has been hit heavily by the not by the first, but mostly by the subsequent, second and third waves of the pandemic. And of course, we have to understand that there has been also, these catastrophic developments with war and with political turmoil. This instability that has also contributed significantly to the situation with pandemic in Armenia. Indeed, initially, in the first months of the pandemic, in the very beginning, it has been, the government has more or less retained control over the development. However, after that, as the cases, began to rise, of course, there have been also very significant, some things that should have been done differently on the part of the government, of the authorities. There has been, of course, for a long time, apparent lack of understanding of the seriousness of the problem on the part of the people, the population of the country, and so that factor, inefficient or only partly efficient management by the government, lack of consolidation, lack of understanding, and also lack of trust in the authorities, lack of trust in the government, which is, I mean, we could dedicate, a whole interview or hours, or we could talk for hours or days about the what part of that has played a bigger role, and what are the deep roots, how this, for example, mistrust in authorities is deeply rooted in the psyche, in the mentality of Armenians, right? You could talk for ages about that. Anyways, these factors, the mismanagement by the government. However, here I can say that once again, this pandemic, even though it had been predicted by many, even though there had been similar problems in the past, however, such a major calamity, a public health calamity, had not struck humanity since 1918, 1920, since the Spanish flu pandemic. It's the worst public health emergency in the past 100 years. So it should not be, it should not come as a surprise that many national governments, or almost all national governments, have had their failures. And of course, Armenia has had their failures as well. Secondly, the factor of the society, the factor of mistrust, the factor of being less able or less willing to follow everything as prescribed, so to say, right? This is also something deeply embedded in the mentality of Armenians. And thirdly, of course, the pre-existing challenges and problems with health system and economic system. And fourthly, the very significant these disasters that the nation has gone, that the nation went through in 2020. Primarily, of course, with war, because I remember very well during the wartime, basically we were going through the peak of the pandemic, and then the whole things, just superimposed one on the other, right? Because there was a very significant. Now imagine that this pandemic is already a super stressful situation for any health system. And like I mentioned a couple of minutes ago, it's, not just Armenia, countries, health systems as stable, as, well-established as, let's say, Italy or Spain or France or UK or New York have completely, totally collapsed during the first wave of the pandemic. Totally collapsed. Thank God, in Armenia, we have almost not had or very insignificantly, for very short time, and not to the extent as in Italy, when doctors were, doing the so-called triage, when essentially when people were dying because of no access to health system. We did have that situation in Italy. We had such situation in Spain, in Britain, almost that situation in France, and we definitely had that situation during the first wave in many areas in the United States, right? Now, if you compare the health system, the pre-existing level of healthcare services in Armenia, which does have its problems, of course, we know we're a country in transition. We are not yet, we do not yet have fully established, developed health system, but like I said, even the well-developed and well-established systems failed to respond in a proper way. And like I said, thank God in Armenia we didn't have many instances of people simply dying because they could not get to the hospital. Yeah. We did have that elsewhere. But of course in Armenia we've had some other factors that played very negatively. And then, again, it is everything should be considered in comparison. We look at the numbers. And we look at the development of the pandemic also in other countries, including the neighboring countries in similar situations as Armenia was, and we see also quite significant figures,
So you live and work in Germany.
Right.
How long you been doing that?
I've been living and working in Germany since 2015 for more than 6 years now. Yeah. However, I retain, of course, connections with our motherland or homeland, with Armenia, and yes, like you promised, we are going to talk a little bit also about our activities in relation to digital health in Armenia.
Yeah, well, I like to keep you in the medicine world. I love to talk about politics, but I don't want to drag you in there, and because you're such an expert, like we're really very concerned in diaspora about the situation in Armenia. We have I don't know where you stand, but we have a government is incompetent. They're all none of them have any experience, and now those people are rushing, going into negotiation with Turkey with any background, any political, diplomatic background. And so this is really concern to all diaspora, and Turkey, of course, is trying to divide between Armenia and diaspora successfully. And so I don't know, what is your input in that?
Well, without, like you said, without living from the track of digital health and medicine and going too much into politics, I have my opinions and everything. But I'd like to say that you've mentioned something very important: the diaspora and people in Armenian diaspora. Now, this is one thing that I am absolutely certain about, and a big part of these efforts that we are currently we're putting into this initiative is based on the understanding that as long as we have this somewhat kind of a watershed between people living in Armenia proper and people not living in the Republic of Armenia, which is collectively referred to as diaspora. I think as long as we have that sort of the division between these two, we would not be able to to meet the challenges. And the challenges we're facing as a nation are very significant. There is, of course, there cannot be any second opinion on that, any other opinion. Of course, the challenges are very significant. The challenges are major, and one may say that we are facing now, of course, an existential threat, an existential
I don't remember when we had the situation like this.
Yeah, probably some 100 years ago, or maybe 30 years ago. But I mean, we know, and everybody knows the history of Armenians. That history has been nothing close to calm and easy. We have always been, or almost always throughout the history of the nation, has been essentially solving existential challenges. However, I think what we need a lot of consolidation.
Yeah, that is what is missing.
We need consolidation. We need to focus on what are the challenges, and to be able to find to work together, not against each other, but working
that
together.
Doesn't exist.
Unfortunately, of course, there has been that has been a problem. That has been a challenge as well. However, again, like I said, our ability to sustain, to develop, and to prosper in the future will, in great part, be dependent on our on our ability to indeed to consolidate and to focus on what we have in common, including our common challenges and common problems, rather than on the differences in ways of achieving our major agenda points. So consolidation is a clue,
very
and
important.
dialogue, wider dialogue is a clue, and also wider engagement of diaspora. Since a few years, I'm not even very much in favor of using the word diaspora. Whenever I use the word diaspora, I always say so-called diaspora, because to me, we should be thinking of Armenians as a whole. That is kind of my
I always use the word
understanding of the
Armenian
situation.
nation.
Armenian nation, indeed, as a distributed or networked nation. And because the strength, indeed, the strength of Armenians, and also historically, that is something that has developed as a result of the catastrophic historical developments, right? Because if not the genocide of 1915, 1923, if not these, the oppressions and all these catastrophes in the end of 19th, beginning of the 20th century, we would have not been now this networked or distributed nation, which is worldwide. But that catastrophe, those historical calamities, they brought about what can be used to be the strength of our nation, right? But only if we are able to avoid this fragmentation, or rather to overcome that fragmentation, to greatly to engage much more significantly people, again, from the conventional diaspora or not living in Armenia proper, to engage them in the political, social life of the nation. I mean, there are challenges there as well, of course. Once again, I wouldn't like to deviate too much from the topic of our conversation, because otherwise it would take us much longer. The challenges there are also available, but that's the way forward. That quote, the former Prime Minister of Israel, Benjamin Netanyahu. Do you know, I've mentioned earlier that Israel is one of the nations that is already positioning itself as the global leader in digital health. And all that essentially received its received a very significant boost directly from the government of Netanyahu. And it was just a few years ago, in 2018, when the government of Israel officially adopted a program that invested or is going to invest over the next 5 years. It's running until this or next year. A total of 275 million worth public investment into converting or establishing Israel as a digital health hub, as the ecosystem of digital health. And I want to give here indeed a quote from what Netanyahu said on the day, and it's available on the government, on the website actually of the government of Israel, so everybody can just check it. And I just want all your our audience or our listeners to hear to what Netanyahu said. Quote, "We are doing something of historic significance. We are developing the industries of tomorrow. In effect, these are the industries of today. They are based on a combination of three things." This is what I mentioned earlier, right? Back to quote, "Very large databases, artificial intelligence, and connectivity." And then Netanyahu continues. This has a greater potential than cyber. It's gigantic, greater than transportation, which is also a gigantic field. This field of digital health is estimated as at 6 trillion USD. Let us assume that we will receive 10% of the real market for this potential, not our market, says Netanyahu, the real global market in the coming years. In my view, this is the maximum estimate. It is 600 billion market. And of it, if we succeed, as we did in cyber and in autonomous vehicles and our vehicle industry, we can expect here a significant increase in new products. What are the new products? Israel has a gigantic database that embraces almost the entire population, a large population relative to, let's say, the Baltic countries, one of which has 1 million in that data bank, and so on and so forth. So it is an initiative that is titled, you know what it is titled? Digital Health as a National Growth Engine. Now, this is basically what we think might be possible or should be possible if we address it properly to replicate in Armenia by Armenians and for Armenians. That is basically what we are working on.
You just put your finger on it. Leadership. Israel had a leadership. Israel did not fight each other. They didn't say who to be our friend, ally, Russia, America, this and that. They said, we are our own ally. You know, you put your finger right on it. It's the leadership.
It's possible to have it in Armenians as well.
Yeah.
That is my conviction. I'm convinced we must be able to also consolidate our efforts. Our leadership should be also capable of understanding where to go and what the potential is, where the potential lies. And we must be able to overcome these, fights and hatred and fragmentation in the nation.
Yeah.
Well, if we are not able to, then, like you said, we will unfortunately continue, and never be able to prosper and to disrupt this vicious circle that we got ourselves into. Let's be optimistic.
There are the words that says from your lips to God's ear.
Right.
That's good to end up with these positive things, and I like really to thank you very much. Maybe we'll have more in future talking some specific technology about we just covered so many areas, and sorry to drag you a little bit in the politics, but because when we are so much in trouble, you just can't help it, to talk about that. And I thank you very much. Please stay there. And let me close this program. Okay. So to our viewer, thank you for watching. And we're going to also publish on YouTube so that you could see it. It's been long. Sorry, we had delay because, always communication, there is something goes when you do live. And thank you for watching.